Now time for the wrist joint.
I'm going to show you how to scan the wrist joint. So specifically, we're talking about the radioscaphoid joint. So the patient position is usually supine with the hand fully pronated and the palm on the table. Now again, I'm propping it up a little bit so the camera can see a bit better. So your landmark is going to be the distal radius. You get that in view in the centered on with the ultrasound probe there. The orientation is going to be long on the forearm, and the movements are going to be distal towards the fingers. So as you can see, I come around from the forearm, just distal until the scaphoid comes into view. I'm going to rotate that a little bit so the camera can see a touch better. So what you see on the left is going to be the radius. On the right-hand side of the screen is going to be the scaphoid. So the area of interest is the area between them. It's almost in a sulcus there. So that's how we scan the wrist joint.
Okay, now time to draw it. So what do we see? Well, we know this is bone, and that's the radius. This is the scaphoid. Next, cartilage. Well, we can actually see some of the black articular cartilage of the scaphoid. Can't really see the articular cartilage of the radius, but we know it's there. Fluid. Well, we know there's going to be joint. Excuse me. We know there's going to be joint fluid there. What holds bones together? Well, ligament. So there's going to be some ligament tissue in here, and there's going to be ligament tissue holding the next bones together. Tendon. Well, we do see a prominent, nice striped tendon pattern at the top. And we're a little oblique on it, so we lose it down here and we lose it down here. And there's no muscle in view here, so we're going to clear that away. One more time. Bone, bone, cartilage is right here. Joint fluid, we know there's going to be joint fluid in here. Ligament, we know, we can't really see it very well, but we know that connecting bone to bone is going to be some ligament. And tendon, we can see some tendon tissue up here, although we're oblique on it. Okay, now time to see what it's like in a live patient.
I'm going to show you how to scan and inject a wrist joint. Position of the patient is usually supine. However, some practitioners would prefer the patient to be seated across the table from them. The landmark is going to be the distal radius, and the orientation of the probe is long on the forearm. There we are. The movement of the probe is going to be distal towards the hand, and here we see the radius come to an end. A small amount of passive flexion of the wrist allows you to see the radioscaphoid joint, or the radioscaphoid interval. And for this injection, the needle comes quite steep, just lateral to the tendon that's in view in the screen, like so. And that's how you do a wrist joint injection.
Now, when I said lateral, I actually meant closer to me. So in this case, it's actually ulnar, but you get the point. Now, time to move on to the quiz. Hey, congrats on finishing that section. Can I show you inside one of our live courses? Let's go.
I certainly can say that Frank's courses are very well structured, very well taught, very practical.
Just even being able to use ultrasound in like the top 25 conditions are the ones that we see in clinic.
There's a huge community and a huge well of knowledge when you join one of the courses and you have access to all of these people who have seen a lot more than you have, and there's no guesswork. You leave feeling very confident with what you need to do to be successful for your patients and then in your practice.
You want to be able to do basic hip injections, shoulder injections, elbow injections, and I think Frank Johnson set up a very good protocol and a very good syllabus to be able to get the top type of procedures you're going to be doing in clinic and make sure you understand those well before moving on to the next step.
My revenue went up almost instantly. There's always now just more opportunity to reinvest into my clinic, reinvest into the things that I like, and I've been very satisfied.